Well, good afternoon or good morning. I guess it's morning. I'm joined by Deputy Mayor Linda Gibbs and Commissioner Tom Farley, and we are here at the Department of Health and Mental Hygiene's headquarters in Long Island City, Queens. At the end of 2011, if you remember, I joined Commissioner Tom Farley and others to announce some news all New Yorkers could celebrate. Life expectancy in our city back at the end of 2011 had reached an all-time high, and the city's infant mortality rate was at an all-time low. And that day, I expressed my thanks for the hard work that went into making that possible, a lot of which begins here in this building with the phenomenal staff of the city's Department of Health. But I also expressed my belief that thanks to our bold agenda to improve public health, along with our efforts to make the nation's safest big city even safer, we were going to see life expectancy continue to rise and infant mortality continue to drop. And I'm happy to say here we are a year later, and that's exactly what happened. Today, the average life expectancy for a baby born in New York City is 80.9 years. That is higher than last year's all-time high of 80.6 years. The number is based on statistics through 2010, the last full year for which we have data, and it marks an increase of 3 years of life expectancy since 2001. Just think about that. The average person in New York City is now living 3 years longer than they did 10 years ago. Life expectancy across the nation also went up during that period, but it went up by just under 2 years, from 76.9 to 78.7, or less than two-thirds of the increase in life expectancy that New York City has seen. New Yorkers born today are now expected to live, on average, 2.2 years longer than Americans in general, compared to a year longer in 2001. So it's a joke, but it's not really a joke. If you have people that live in this country, on average, and you want them to live longer, if you really care about them, they should come and live in New York, because it's not funny. They will live, on average, 2.2 years longer in New York City than they will if they live on average anyplace else in the country. That's not to say any one person will, but on average, which is the only ways you can plan your life, the news is phenomenal. Average life expectancy in our city is higher than the national average for both men and women. Life expectancy at birth for New York City, men is now 78.2 compared to 76.2 years for men across the United States. And life expectancy at birth for New York City women is now 83.3 years compared to 81 years for all American women. So women are going to live, on average, baby born today, to 83.3 years, and a man is, unfortunately, given my gender, only going to live 78.1. But that's, if you think about it, that's a difference of 5 years that the average woman in New York City is going to outlive the average man. And the greatest increase in life expectancy across the major racial and ethnic groups the last decade was among African Americans. African American New Yorkers' life expectancy at birth increased by 3.8 years from 2001 to 2010, closing the gap with whites and Hispanic. Now, there's good news for those of us who are at age 40 and above. Life expectancy numbers I was giving is for a baby born today. And remember, that assumes that there's no improvement in science, which has not been true for a long time. Science keeps getting better, medicine keeps getting better. And it also is an average. So if, for example, you don't smoke, your life expectancy would be in a different cohort and be significantly higher than the average numbers that I've given you. Let's take a look at those 40 and above. Life expectancy from 2001 to 2010, average life expectancy for 40-year-olds in New York City increased by 2.5 years to 82.3 years compared to 80.5 in the U.S. in general. So a 40-year-old New Yorker can expect to live another 42.3 years, almost 2 years longer than the average American who's 40 years old today. And New York's gain since 2001 is substantially larger than the 1.3-year increase for the same age group in the U.S. as a whole. So if you think about it, let me go back and look here. If you were born today, the average life expectancy in New York City, a baby born today, is 80.9 years. If you are 40 years old today, the average life expectancy is 82.3 years. Let's take a look at something that near and dear to my heart. Over the same period, life expectancy for 70-year-olds in New York City increased by 1.5 years compared to 0.9 years for the nation. And life expectancy for a 70-year-old in New York City is now 87 compared to 85.5 nationwide. Big increases are being seen in all age brackets, and taking all of these age groups into account, the city's overall life expectancy has improved faster than any major city since 2001 for both men and women. And you say, why is life expectancy going up? Well, one of the reasons is that infant mortality in New York City is going down. The life expectancy is due in part to the declining infant mortality rate, which I'm pleased to announce has reached another all-time low. This rate you want to go down, life expectancy rate you want to go up. In 2011, New York City had 4.7 deaths per 1,000 live births. That's a decrease of 23% since 2001. The nation as a whole has also seen a decrease over that period, but only 12%, about half the decrease that we've seen in New York City. So New York City, infant mortality has decreased 23% in the last 10 years, but in the country only 12%. The city's decrease exceeds the goals, incidentally, that we set out in our Take Care New York program, which aimed to reduce infant mortality to 5%. So instead of 5%, we're already below that at 4.7%. And it also exceeds by far the U.S. Department of Health and Human Services goal of 6 infant deaths per 1,000 live births by 2020. The U.S. government is trying to get down to 6 per 1,000 by 2020. We already are down to 4.7 here in 2012. And New York City has seen that decrease, incidentally, across all ethnic groups. For infants born to non-Hispanic whites, there's been a 26% drop since 2001 from 4.2 to 3.1 deaths. For infants born to non-Hispanic blacks, a drop of 19% from 10 to 8.1 deaths. And for infants born to Hispanics, there's been a drop of 13% since 01 from 5.6 to 4.9. Now, while these numbers are great and far below national averages, especially for non-Hispanic blacks, they also show that we still have work to do to reduce racial and economic disparities in infant mortality. And the city, you should know, is working hard to battle those disparities and to improve the health of mothers and infants through a number of programs, including the Nurse Family Partnership, the Newborn Home Visiting Program, the Infant Mortality Reduction Initiative, Breastfeeding Promotion, and the Safe Sleep Initiative to prevent infant deaths due to accidental injury. And we are making progress. Now, both pieces of today's announcements, I think, are testament to the public health gains we made in recent years, and we know that because the Department of Health analyzes information on death certificates. And what we found is that New York City's increase in life expectancy is attributable to several major factors. That includes significant improvement in the detection and treatment of HIV. HIV and AIDS took a terrible toll in past years, as you remember, but when New York City, that was when New York City really was the epicenter of the epidemic. But New York City has since then become a leader in combating HIV, especially by focusing on testing. Our public hospitals and healthcare clinics began offering HIV testing as a routine part of medical care for 5 years before the state required us to do so, and our efforts to ensure that every adult in the Bronx and Brooklyn knows their status has further reduced infection rates. Today, more New Yorkers are getting tested than ever before. In fiscal year 2011, HHC facilities tested just under 200,000 people, more than 3 times the number tested in 2005. Preliminary numbers show that 3,400 new cases of HIV were diagnosed in New York City in 2011, and that's a decrease of 3.6 from 2010 and 35% from 2002. And those who test positive are getting better treatment faster, and as a result, the mortality rate from HIV infection decreased by a remarkable 52% from 2002 to 2010. The mortality rate from heart disease has also dropped sharply over the past decade by 27.9% from 2002 to 2010. And a large part of that is due to the city's aggressive approach to reducing tobacco use, which has led to a 30% decrease in the number of smokers in New York City since 2002. There are now nearly 400,000 fewer smokers in the city than there were at the start of our administration, and that decrease will mean something like 50,000 fewer smoking-related deaths by the year 2052. Most encouraging, smoking among teenagers has dropped dramatically. Over the past 10 years, we've cut the proportion of public high school students who smoke by more than half, from 18% to 8.5%. And by comparison, the CDC reports that nationwide, about 16% of high school students smoke. So 8.5% of high school students here versus 16% of high school students nationwide. And that translates into an overall cancer mortality rate in our city that has decreased by 4.3% since '02, from 170.2 to 162.9 deaths per 100,000 people. The good news with kids, of course, is if they don't smoke as a teenager, they're a lot less likely to smoke as an adult, so it will really make a big difference in their life expectancy. The decrease in deaths from heart disease is also a result of improved care for people with high blood pressure, high cholesterol, or heart disease. And we're taking action to bring that down even further by launching a number of programs to stop the rising tide of the obesity epidemic, from requiring calorie counts on menus to capping sugary drink sizes to increase access to healthy foods in neighborhoods where they're historically been hard to find. And thanks to all those efforts, we're starting to make progress. In fact, it was just reported today that the city's childhood obesity rate dropped by about 5.5% from 2007 to 2011. And we can expect these efforts will continue to drive the city's life expectancy even higher. So it comes from less smoking, it comes from focusing on obesity, it comes from focusing on better detection and treatment of HIV. All of those things are some of the real drivers of why life expectancy is still going up in this city. And in cities that don't have these programs, that's why their life expectancy is a lot worse. This has real-world consequences. A lot of you treat these things as jokes. They're not jokes. They're people's lives that you're dealing with. And when you talk about 8.4 million people in New York City living 3 years longer than they did 10 years ago, it is just one of the great improvements in life expectancy ever found on the face of the earth. A number of other factors contribute to the life expectancy success here. We just finished the second safest decade in the city's reported history. We're on track to have the lowest number of murders in the city's history, and we always think we can do better. We have the fewest number of traffic deaths. We have the fewest number of fire deaths. We have the fastest ambulance and fire and police response times that we've ever had, particularly ambulances. That makes an enormous difference. If you have a stroke, seconds really matter in whether you're going to survive. The Health Commissioner, Tom Farley, and his outstanding department, the Department of Health, really has made an enormous difference to people in this city. They deserve a lot of credit for making the city a healthier place and for leading the way for other cities around the world to take action. Dr. Farley, you want to say a few words?
Thank you. It's a great day to be a New Yorker. The mayor has just shown you the statistics why. There are just three things that I want to add to what the mayor said. First, the causes of death that have contributed most of these improvements in life expectancy are heart disease and cancer. Those are our biggest killers today, and the risk factors for those are the things that we've been working on: smoking, unhealthy diet, physical inactivity. That says that something we're doing is working. Now, these diseases still kill far too many New Yorkers, but what that means is that if we continue to work on those, we can continue to show big improvements in life expectancy. Second, many people around the country are trying to reduce health disparities. Here in New York City, we're doing it. African Americans showed the greatest improvement in life expectancy of all racial and ethnic groups at 3.8 years over the last 10 years. Now, we still have a long way to go, but that kind of progress to me is very exciting. Third, we've seen some reductions in mortality for nearly every cause of death. Now, there are many different causes of death that have common origins, even if we don't fully understand the mechanisms for them. The poverty and lack of education and the chronic stress and risks that go along with those increase your mortality risk in a variety of different ways. The fact that nearly all of these causes of death are showing improvements is the best evidence that I know yet that New York City is increasingly becoming just a better place to live in. So looking at this, I can only conclude one thing that the mayor's already said. If you want your family and friends to live long and healthy lives, tell them to move to New York City.
Thank you, Tom. Before opening the floor to questions, let me just summarize for our Spanish speakers. El promedio de expectativas de vida de los neoyorquinos es ahora mejor que nunca. Los neoyorquinos viven casi 2 años y medio más que el promedio nacional. También el índice de mortalidad infantil en la ciudad ha llegado a nivel históricamente bajo. And with that, we'll be happy